LASIK is a procedure in which we modify the shape of the cornea to correct any underlying refractive errors that you may have. And by refractive errors, we mean nearsightedness, farsightedness, or astigmatism. Now, LASIK, by definition, involves the creation of two components. The first component is where we create the flap, what we call the intralaser, which is an all-laser, bladeless approach to LASIK, in that the laser itself is actually able to create the flap. We simply lift the flap. There is a hinge by which the flap is attached to. We flip the flap over the hinge to expose the underlying tissue. It's the underlying tissue that's going to be reshaped by the second phase, which is the excimer laser-based part of the procedure, where we're using laser pulses to change the shape of the cornea in a way that takes care of or corrects the underlying refractive problem that you have. Once the laser has reshaped the cornea, we simply put the flap back into place without the use of sutures or glue or any other adhesives. The flap is able to stay in place just by the inherent tissue forces that are present. And once that has occurred, the flap repositioning, we are done. You're able to go back to the recovery room at that point in time. So in essence, it takes about 10 minutes to do a LASIK procedure.